Rabbil Alameen wa salatu wa salam ala ashraf al-mursaleen nabina Muhammadin wa sallam. Aida, thank you very much. We are here in Makkah with all pilgrims of the Gambians here in Makkah al-Mukarramah. Inshallah, the announcement of going to Mina will be, as they used to say, Saturday night. It is Sunday night in Islam, but it is Saturday night, inshallah, on the 8th, because all the pilgrims will leave Makkah, inshallah, on Sunday from 12 o'clock in the night, inshallah, early morning of Sunday, go to Mina, bi-idhnillahi ta'ala. They will spend a day in Mina, which is on the 8th, then they will proceed on the 9th, which is Monday, to Arafat, inshallah, tabaraka wa ta'ala. They will spend also the day at Arafat. After the sunset, they will leave Arafat, all of them, inshallah, to come back to Muzdalifah, where they will spend the all night, and then pick their stones where they will throw it at the Jamra, inshallah. That will be on Tuesday, that is on the 10th of the Hijjah, inshallah, tabaraka wa ta'ala. Then all pilgrims are here, and they will leave Makkah to Mina, inshallah, on Sunday, bi-idhnillahi ta'ala.
Thank you, Dr. Michael Baka. Dr. Abubakar Senghor is a member of the Hajj Council, and we asked him his impression so far.
Thank you very much, Jaida. So far, so good, alhamdulillah. The organization is very impressive. The Hajj Commission, the Army of Hajj, his deputy, and the entire team are keeping closely monitoring all the activities and the events here. They are all doing well. Where we are now, all the pilgrims are in Makkah. Alhamdulillah, the Ziyarah aspect that was the Medina leg is over, and all our pilgrims are sort of accounted for. The Hajj guides, the GIA staff, and their staff, and the medical team, they are all doing well. And we hope that, inshallah, if things go the way they are now, everything will be fine, and that's what we are praying for. And we hope that you all, Gambians, will be praying for us. And we also be praying for all that we hear, inshallah, so far so good.
Meanwhile, according to medical officials, pilgrims are all in good condition of health and are all ready for the Hajj. Reporting from the holy city of Mecca, Anaidaju.
Bansang Hospital has received an assortment of materials worth $300,000 from Gambia Civil Aviation Authority. Officials of the Aviation Authority say the donation is in fulfillment of the body's corporate social responsibility. Roy Bite has the details of that development.
Its contribution to nation building, the GCAA has over the years been actively involved in improving the living standards of people in the country. One of these is by proving hospital items to the female ward of the Bansang Hospital.
Coupled with our desire to create convenience and comfort for all human beings, the management of the Gambia Civil Aviation Authority, under the leadership of Mr. Abdullahi Ibrahim Jame, has been paying great attention to all areas in the development agenda of our government. And over the years, we have taken great strides to contribute to the promotion and development of all sectors, particularly in the areas of education, agriculture, sports, tourism, and others. The campaign to boost the health sector has also been given very high priority, and therefore over the years we have been cooperating with Bansang Hospital and have now identified the female general ward.
Since women and girls constitute a great chunk of the country's overall population, and given their efforts in national development, the need to improve their health status is considered one of paramount importance.
Their focus was on other areas, education, agriculture, and other areas. But notwithstanding, they haven't forgotten the hospital. But because of the attraction at that level, sometimes if you are not very careful, you are sort of removed. But looking at the population around this end, these are the people who are most disadvantaged, not only in health service delivery, even in terms of their wealth. Because the poverty index has indicated that the poorest people live around this area.
Built since 1938, Bansang Hospital not only remains one of the oldest health facilities, but also a major and strategic referral hospital, serving the healthcare needs of residents of both the central and upper river regions. These $300,000 worth of essential items are earmarked for the hospital female ward.
35 pillows, 35 blankets, 35 plates and cutlery, which are cups and spoons, 10 window curtains and curtain rails, 5 tarpaulin plastic curtains for toilets, 10 brooms for mopping, 1 television set, 1 fridge freezer, 2 electric kettles, 35 admission folders, 35 visitors chairs, 1 medical cupboard, 2 BP machines, 2 AccuCheck machines for blood sugar testing, 4 thermometers, 4 ceiling fans, and 1 wall clock.
It's only people who love, who cares for people, who think of areas like Bansang and other hospitals. And definitely we have seen that the civil aviation, they are aware of the needs and aspirations of the people, especially the people of Sierra, and they have come, and we are going to hold you with all our distinct to embrace you so that at least you remain with us. So definitely this is a very noble gesture, and we are proud of you. We are very much grateful. We want you to know that we are really appreciative of all what you have done, and there is no word we can say, but thank you.
The beneficiaries were full of praises to the benefactors for the laudable gesture and assured them for the proper upkeep of the items. With the mantra that a healthy nation is a wealthy one, the handing of these hospital materials has been lauded as a step forward in the country's healthcare delivery system. Rohi Bitey, Grts News.
The fight to eradicate polio is becoming a dangerous mission in Pakistan. More on that scenario and other stories in a moment. Welcome back. The fight to eradicate polio is becoming more dangerous than ever in Pakistan. It's one of a handful of countries in the world where polio has not been wiped out, but extremists are targeting people who give children the vaccines. We have more in this report prepared by CNN.
Protecting children from polio with a few simple drops of vaccine has become a dangerous task. Not for the children, but for people like Gulnaz, who works in one of the most violent areas of Karachi, Pakistan's largest city. It's so dangerous, we can't use her full name. Last year, her niece and sister-in-law, also polio workers, were gunned down by armed boys on motorcycles. UNICEF says it was simply for giving young children this vital vaccination. But that hasn't stopped her.
Everybody in my family was suffering from shock. Some of them tried to stop me, telling me not to do this job anymore, because 2 coffins leaving one house leaves a mark.
Anti-polio campaigns have been targeted ever since US intelligence used a fake vaccination program to help in its hunt for al-Qaeda leader Osama bin Laden in 2011. That wasn't a polio campaign, but the damage was done. Since July 2012, 22 polio workers and escorting police have been killed. I asked Gulnaz if she's concerned about working in the same area after so many attacks, including the ones against her family.
After this tragedy, I'm not scared at all. In fact, I feel even stronger and more determined. Every woman in this country who is doing this job is praying for me. When I'm working in the field, I'm with my partner, but I also sense that my niece and sister-in-law who were killed are walking alongside me.
We couldn't film Gulnaz and Shazia in the area they usually work in for their safety and for our own. Because of the threat there, they have to be escorted by paramilitary soldiers, sealing off the area and guarding a street at each end, simply so that young children can be given these crucial drops that most parents and children around the world can get at their local doctor's surgery. Usman was infected